Good afternoon, everyone, and good afternoon, Minnesota. We're used to being up here and giving briefs on COVID-19. Of course, Commissioner Malcolm did that today, or some of the issues in a special session. Today is back to a day that I think it's safe to say is one of the most enjoyable things you get to do as governor, watching advocacy of citizens turn what they believe is something, and in this case it's certainly true, something that would make lives better for Minnesotans, turning what was pain and anguish into activism and now today law that will go forward to help others. We're here today to launch and celebrate the Minnesota Insulin Safety Net program. Minnesotans in urgent need of life-saving insulin, and we've heard these stories for years and years. We're priced out of it. The horrific stories of Alec Smith and so many others of rationing insulin are going into diabetic shock because they couldn't get it. Those days now end here in Minnesota. And one of the things is because of the countless advocates across the state who rallied against big odds when you're fighting an industry that can put 700 lobbyists into Washington, D.C., can put 30 on the ground in St. Paul to thwart anything you do that might imperil their bottom line. It's a pretty uphill fight. But what I found is that, like so many times, Minnesotans and this group of Minnesotans simply did what was right time and time again. I'm going to be joined by the Lieutenant Governor will speak here shortly, and then we're going to hear from Nicole Smith-Holt, who anymore in Minnesota needs no introduction, a mother who turned her grief into action, and this piece of legislation named after her son. James Holt is here. Alexa Stanley, who I got to know during this campaign of change, who simply turned passion and advocacy and a gift for articulating clearly what's at stake to becoming a change agent, and one that this will not be the last you see of Alexa Stanley, I'm sure. And then we have that combination of activists combining with talented legislators and leaders in Representative Howard and Senator Little, two of our chief authors who turned this in, worked together, find common ground, and we're able to get this thing across the finish line. So this piece of legislation, the Insulin Safety Net program, does two things. The Urgent Need program makes eligible Minnesotans receive once a year 30-day supply of insulin immediately at their pharmacy, no more than $35 copay. And then the Continuing Need program for eligible Minnesotans to receive up to a year's supply of insulin for no more than $50 per 90-day refill. This is a triage bill. This is one that stepped in and filled an incredibly important need, but it also proved the inaffordability of pharmaceuticals is still and remains a problem. It's one that I think this proved that we could get there. It was a first step, and I have no doubt that especially the legislators are here are already thinking what the next step looks like, what the next piece of legislation looks like to address this very issue. Minnesotans should visit Minsulin, MNINSULIN.org to see if they qualify and learn how to apply. And again, this proves that our democracy still works. A problem presented itself. Advocates took it upon themselves to educate legislators. Legislators educated along with them and then brought others in, and we were able to craft a piece of legislation signed into law that goes to effect in Minnesota today, July 1st, 2020. With that, I'd like to turn it over to Lieutenant Governor Flanagan.
Thank you, Governor. And today is a day that we have been waiting for years, and that the advocates in this room have been working towards for years. The day that the Alec Smith Insulin Affordability Act goes into effect. Together, we have built a safety net for thousands of Minnesotans with diabetes. Beginning today, no one will be forced to choose between paying their rent or putting food on the table and the life-saving insulin they need to survive. This law will save lives. We did not face an easy fight. The odds were against us. But the power of a friend's concern, a legislator's determination, and above all else, a mother's love didn't just get this bill across the finish line. You built a bipartisan coalition with near unanimous support in a divided legislature. It's a big deal. That is the power of your stories, the power of the memories, and the power of Alec's story specifically. Today is a celebration. And the news from Big Pharma late last night will not dull this victory. They may continue fighting, but so will we. And we have the advantage of being right. And it is truly my honor to be with you today. I talked to my daughter today. She said, "Mom, why do you have to go to the office?" Because she's gotten used to me working from the kitchen table. And I told her the story about Nicole, about a mom who was an advocate for her kid and who fought very hard to make sure that everyone who needed insulin could afford it. And we talked about Big Pharma and that there's some folks now who are fighting back to try to prevent this from happening, simply due to money. And she said, "Mom, that's not fair. That's not right. If people need medicine, they should get it." And I think if a 7-year-old child can understand that, we know that Minnesotans understand that too. And so it is just my privilege, and I have to tell you, I've been able to introduce Nicole Smith Holt and James Holt at other press conferences, but today it feels particularly sweet as we come together. So with that, it is now my absolute honor to invite Nicole Smith Holt and James Holt to the podium to say a few words.
So this past Saturday, on June 27th, was the 3-year anniversary of Alec's death. Today, on July 1st, 3 years after he died, we should be celebrating the hard work of all the Minnesota Insulin for All advocates. Today, we should be celebrating the fact that there is a safety net in place for people in Minnesota who, like Alec, find themselves in a situation where they don't have the resources to buy their extremely expensive life-sustaining insulin. Many hours have been dedicated to finding a solution to help those in need. The initial bill was not supported by the Senate. Negotiations occurred and a compromise was agreed upon because we had been told that insulin manufacturers would not challenge the final bill. We were told that by the Senate bill authors, that the insulin companies would fight the DFL plan and we would have had the bill tied up in courts. Well, look at what happened in the 11th hour of the bill going live, a lawsuit from Pharma to say that the decision of Pharma to challenge on behalf of the 3 insulin manufacturers, Alec's Law, on the eve of its implementation is a tragedy. That's an understatement. This law was designed to provide insulin-dependent diabetics who faced with being able to unafford the high cost of their insulin with emergency access to this life-sustaining drug. It was written and signed into law to prevent senseless tragedies like the death of Alec and others from occurring again in Minnesota. But the real tragedy here is that we are in the midst of a pandemic that has resulted in mass unemployment and the closing of the Canadian border, which many Minnesotans cross to buy insulin at a fraction of what it costs in the US. Without the safety net that Alec's Law provides, we're going to see more Minnesotans die and face serious long-term health consequences because they don't have emergency access to insulin. So unfortunately, we are once again seeing the power and greed of the insulin manufacturers and their enablers putting profit over people and standing in the way of smart, workable solutions. These are the same people who have driven up the price of insulin to unaffordable levels simply because they can. And today they have filed a lawsuit to stop a meaningful, workable solution to the tragic deaths of those who suffer the consequences of that big business model, simply because they can. All Minnesotans should be disgusted with this attitude. My hope is that at the end of the day, people in need can access the program. People who are at risk of dying are able to get the assistance that they need. Last night, as the news broke about the lawsuit, I was actively working to ensure people who are at risk of death were able to get the insulin that they need, while pharma was actively finding ways to prevent access to affordable insulin. I cannot express enough the gratitude to the governor's team, to the legislators who have fought beside us, in the Attorney General office, and the entire diabetic community. Thank you. We are not done fighting. We have so much more work to do, and we will not allow this to alter our path to success.
Good afternoon. My name is James Holt Jr., SEIU board member, Insulin for All advocate, the father of Alec. Today is supposed to be a great day in Minnesota, a day to celebrate, a day we have worked so hard to see. We have been working nonstop with the legislators to create and pass the Alec Insulin Affordability Act. Too many hours to count have gone by into passing the bill that has the ability to save lives. Countless lives have been lost to farmers' greed, and I believe we are on the verge of seeing many states stand up and fight back. I believe this is why they've decided to block the bill in Minnesota. They're scared. To say we are frustrated at this development is an understatement. Frankly, my family's outraged. The Minnesota Insulin for All team is more than ready to fight. We have done nothing but fight for years. The people of Minnesota are ready to stand up and fight. The bill is necessary to prevent loss of life, and we will not allow a farmer to continue to ignore people dying because they can't afford their medicine. We must remember that this bill was only a safety net. This was to help in emergencies like Alec experienced. This was not even a bill that lowered the cost of insulin. This was a bill that was designed to assist with saving lives. Untimely, we need legislation in place to lower and cap the prices of medicines, but it needs to be done on a federal level until we get to a point that this bill was created to save lives in Minnesota. We are thankful for legislators in Minnesota and the governor's team who have supported type 1 diabetes in Minnesota and the fight for Alec's bill. Thank you. Next up, I'd like to have Alexa Stanley come up.
Hi, my name is Alexa Stanley. I'm 21 years old and I go to Concordia University in St. Paul. I've been type 1 diabetic for 2 years now and have also been fighting for Alec's bill for about that same amount of time. I spent a lot of time yesterday, happy and excited, trying to figure out how to express my emotions about Alec's bill being implemented today across the state of Minnesota. Around 9 p.m. last night, I saw a tweet about the pharmaceutical companies suing the state of Minnesota and trying to halt the implementation of this life-saving bill, and the happy and excited mood I was in turned into tears and a phone call to my parents. On Monday, I went to pick up my prescription of insulin for the month of July. The retail price of my 30-day supply was $659. I wasn't shocked or surprised, because it's always been that high, if not higher. Since being diagnosed back in 2018, the retail price of my insulin went from around $250 a vial to $330. That's an $80 increase with no change to the insulin at all. We are living in a pandemic. In May, 302,000 Minnesotans were unemployed. That means 302,000 Minnesotans are out of health insurance and income. Today is July 1st. Rent is due for many across the state. Imagine going to pick up your monthly supply of insulin, having to pay $659 just to stay alive, and then having to pay another $500 to $1,000 for rent, a place to live, all while being unemployed and uninsured. Alec's bill was created to save lives. Thousands of diabetics throughout the state of Minnesota are relying on this bill. Thousands of diabetics' lives will be saved because of this bill. Our lives, they're already hard. The pharmaceutical companies that decided to sue the state of Minnesota in the 11th hour before the bill was implemented are trying to make them harder. This program gives people a chance to avoid rationing their insulin. The fact that these companies said that they've advocated for real policy reforms is appalling. That is insulting to all the Insulin for All advocates that have been tirelessly fighting and advocating for the real policy reforms. These companies claim to have solutions to our problems already in place, but if that was the case, 1 in 4 diabetics would not be rationing their insulin. I'm 21. 5 more years and I'm off my parents' insurance. This bill means the world to me. I see myself in Alec every single time I talk to Nicole and James. I'm not far from where he was when he was rationing his insulin because he couldn't afford it. This fight is not over, and today we're going to celebrate the implementation of Alec's bill, and nothing is going to take that away from us. And next, I'd like to introduce Representative Michael Howard, who has been by our side fighting since day one.
Good afternoon. My name is Michael Howard. I'm the state representative representing Richfield. And today is a good day. Today in Minnesota, if you or a family member is struggling and cannot afford the insulin they need, they can go to mninsulin.org, fill out a basic application, walk into your pharmacy, and get a fill of insulin for $35. This may sound like a small change for folks, but for thousands of Minnesotans across the state, this is a life or death change. And because of Alec, this law will save lives. And today is about Alec, and it's about the Minnesotans like Nicole and James and Alexis and countless others that fought a true David versus Goliath battle and won, and delivered this piece of legislation that will ensure that no one loses their life because they can't afford the insulin. And so I want to share just a couple important messages to Minnesotans today in the wake of the last-minute lawsuit filed by Big Pharma, which I think part of the intent is to confuse Minnesotans. And make no mistake, today, Alec's law is the law of the land in Minnesota. You can go to the website, mninsulin.org, utilize this program, and get the insulin you need to survive. We are moving forward, and this law is the law of the land. And the other important message is that this fight isn't over. We've heard that today, and Minnesotans have stood with folks like James and Nicole and Alexis, and we need you to stand again and fight together against truly a soulless industry who will do anything to protect their profits. And let's just be clear about why we're here. This vial of insulin that cost about $30 now costs more than $300. If Big Pharma didn't want to face Alec's law, what they could do is make this life-necessary drug affordable to Minnesotans. This is an industry that raised prices 1,200%. This is an industry that's fought in Washington, D.C. to prevent biosimilars to come to market at a lower price. This is an industry that's pulled out of the R&D in insulin because they know that this is a cash cow for them. This is an industry that profited $20 billion last year. And it's an industry that fought tooth and nail unsuccessfully to stop Alec's law. And so today is a good day, And I'm resolved, along with others, that we will continue to win. And I hope it's all right. I'm going to share, Nicole and I were texting last night, and the last thing she said was, I know in the end we will win. And we will. Thank you. Next, I want to introduce Senator Matt Little.
Well done, Rick.
Thank you, Representative Howard. The first thing I want to do is recognize the work that Senator Wickland has put into this bill. She could not be here today, but certainly her patience and dedication are why we're here today. That being said, we shouldn't have to be here. That vial that was held up costs $3 to $7 to make, depending on the type of insulin. And so when it gets to someone that needs it, it shouldn't cost $350 or more. You can make a profit, a fair profit, but not at the expense of people getting sick and dying. This bill that goes into effect today is what all of us here would consider a small bill. It's going to help people. It's going to help make sure they don't get sick and they don't pass away. But this is a small bill just to get insulin into the hands of people who need it. This bill doesn't lower the cost of insulin. And that's a problem. And I've committed to Nicole and James that we are going to keep working until this bill is no longer necessary. Because you shouldn't need emergency insulin. You should just be able to get your insulin. So I want to end just speaking directly to Pharma, the organization that has filed a lawsuit last evening. Spend more money, hire more lobbyists, hire more lawyers. Because you are in a fight against Nicole, James, and Alexis, and I do not like your odds. Thank you. I'll turn it back over to the governor.
Thank you, Senator. Well, thank you to each of you. And again, I would mention I'm not surprised that Pharma tried to put themselves into this so that they could get into the story. But I'll go with what Nicole's last text was. We will win. And today is not Pharma's day. Today is Alec's day. And with that being said, I, as Governor of Minnesota, would like to issue the following proclamation. Whereas the price of insulin has increased 1,200% since 2001. Whereas when Alec Smith turned 26, he was no longer covered by his parents' health insurance and rationed his supply of insulin because he could not afford that. Whereas Alec Smith's dream to open his own restaurant was taken from him in 2017 when he died from ketoacidosis after rationing his insulin. And whereas Nicole Smith Holt and James Holt bravely shared Alec's story and advocated for legislation to hold pharmaceutical companies accountable so that no one loses a family member because they cannot afford insulin. Whereas on July 1st, 2020, the Alec Smith Insulin Affordability Act goes into effect to provide a safety net for people in Minnesota struggling to afford their insulin. Whereas we must continue to fight for access to affordable prescription drugs and health care in Alec's name. Now, therefore, I, Tim Walz, Governor of Minnesota, do hereby proclaim Wednesday, July 1st, 2020 as Alec Smith Day across the entire state of Minnesota. Thank you all for the advocacy that you've done. Thank you for making a difference in countless lives. Thank you for showing the courage of what it looks like to change for the better, change our state for the better, and help hopefully send a signal to other states who haven't got this far. I am proud to stand with you. I want to thank the legislators for continuing to get this right, and this is just the first of many steps. With that, I think we'd be glad to answer any questions. Yes, it's a good, yes, exactly the same way. I actually heard it the way I hear many things, a text from the Lieutenant Governor who keeps me informed. And it was a, well, I'll just be candid, it was a what the hell. And the thing that's most frustrating about this, and I think you heard Nicole because she understands very clearly how legislation works, we compromised on this bill with them to set down, and we were assured if we did that under what they were trying to do, that they would not bring this to court, and this would be a way to find a common ground. Just to be clear, these folks have access to every single telephone number. They have my phone number. I never heard a word. I heard no inkling they were going to do this. I heard no chatter there at all. And I don't know for the rest of you that, so very frustrating, very typical. I got to be honest, they did something I didn't think was possible. They're more hated than COVID-19. How do you do this? How do you decide to be so awful on the day before this? They knew what today was. They would have anticipated that we were going to bring the family here and talk about this. And my hope was, in my remarks, to talk about the willingness of pharma to maybe help, but there's more they could do, but we appreciate that they were trying to help. But oh no, it just for 1 minute, a shred of humanity might have been running through things. They decided to take that. So I again apologize that I am as deeply frustrated and angry as the folks up here are. Yes, we were told they weren't going to sue. Well, I don't know if the legislators know on this. I mean, when it comes back and our team's in the room, that I don't know if this is the vague they that we need to get at, but it was my impression. Maybe Senator Little, if you want to. I was a little bit, I guess, not happy that I heard when to respond to this, that the response was the timing was bad on this. This isn't just about bad timing. This is about bad faith and a whole lot of other bad things. So, Senator, if you have a better idea.
Thanks, Governor, and I think that's a pertinent question for today. You know, it was said on the floor, and it was said in a lot of our private conversations and in our ad hoc working groups that we should do this version because at least we can have something on the books that won't get sued. I mean, we were told that multiple times. And so I think this is a great question that you should reach out to Senator Jensen and Senator Pratt on, because these are the things that they were saying.
Thank you. No, I have not. I'll let Representative Howard speak. I have not. And again, it's pretty strange that something this big that I would hear it and we would hear it via news when it's announced. That seems pretty strange to me.
I heard about this, I think, like a lot of folks did, just seeing a tweet last night. So I don't think a lot of legislators were given a heads up. I did have a brief conversation with Senator Jensen this morning. You know, I don't know if there wasn't any indication that Senator Jensen was given a heads up either, but I don't want to speak for Senator Jensen. He did share disappointment. We did talk about how important it is that we get out the message to folks that this is the law of the land, that despite this lawsuit, right now, Minnesotans can walk into the pharmacy and access this law. And we talked about the timing of the lawsuit coming at the 11th hour, and, you know, frankly, the timing of it would indicate to me that part of the intent here is to confuse Minnesotans and put a cloud over this law. And so it really is important to get the message out to Minnesotans that if you or a family member is in dire need of insulin, this law is on the books and you can use it right now today. I guess what I would say to that is everything throughout this process has shown that there is ill intent amongst the pharmaceutical industry. They have not been honest, they have not been clear, they have not been straightforward, they have not been willing to come before a committee and show their face. The reason that things are confusing is by design, by an industry that wants to hang in the shadows, spend their money, and throw their weight around like they do. And so in terms of the blame, I would assign the blame on the pharmaceutical industry.
Yes. Yeah, no, they never, it's a good question. The question being, and I did, and it's one of the things that I did, and it's the style where I go about it. I asked them all to join us on a conference call. Originally, Pharma is the trade group for each of it, whether it's AstraZeneca, Merck, whatever it would be. And I asked them to put all of their folks on there. And of course, this case, I believe there's 4 major manufacturers of insulin that make up the bulk of it. Asked them to get on early and told them we were trying to do this. Get on early and told them there was a good faith effort of them saying, we'd like to try and work with you. We want to work and see where things are done. Representative Howard, again, I don't want to know what was in people's heart, but it was clearly conveyed to our office that the compromise version that was coming from the Senate was the one that would ensure that Pharma wouldn't sue us. Now, I guess maybe I'm assuming something there, that someone talked to Pharma. I do think there needs to be some good background work here to go to how did we get to that? Did anybody know we were going to get sued on that? Because I think it was clear they were looking at the New York case early on. They were looking at the constitutionality issue of the taking side of things, and that this was crafted in a way that it was my impression the entire time and conveyed to me that they were acceptable with this and would let this stand. Yeah, no, this is a good question, too, on the temporary restraining order. I have really, really smart attorneys in my office because I am not an attorney. But I asked them about, how do we respond? And they were saying what Representative Howard did. They probably did this at the last to muddy the water. The one thing we should say is no court has ruled on this. I would have to say, and again, sometimes not being an attorney helps on this, it would be my thought on this that maybe they didn't do that because they wouldn't have it granted because of the life and death situation of this, and they would start out with a loss right in the beginning of this because they are going to take this to court. And anytime you go to courts, I'll trust they'll do the right thing, but I would suggest for all of us, we start working as a bulwark against that to craft something that can't be taken down through the courts on this. So I think it's going to be incumbent on those folks in the Senate to come back and help us craft something that does that. So I think maybe that's why they didn't ask for the injunction, because I think it wouldn't be granted. Well, and again, I think James said it right. It's certainly a federal issue, but we want to see on pricing. I'm very curious now about how we come back at it. I mean, this is clearly damaged and I've tried really hard to work with Pharma. My line to them always is that I get it. These are life-saving drugs that you produce. There is a profit to be made in this as long as they're not obscene and we make sure that people have that affordability. But I always used to say to them, well, at least you're not tobacco. Today, they have entered the realm of tobacco, that it's all about, the misinformation campaign. It's all about merchants of doubt, just throw that in there. So we'll have to see. I mean, we're going to have to come back at this, but this is certainly bigger than Minnesota. I'm just proud in Minnesota that we made the case. These advocates and these legislators said the first thing we need to do is create a safety net. And I don't want to undermine the importance of that safety net on insulin, but this goes to other drugs too. And families, and especially if they're even rarer than diabetes, it becomes even more challenging. Yeah. I've got some experts here. We've got Nate and Cody here. Somebody want to come up? We have our experts who are implementing the program over at MNsure and Board of Pharmacy. So, but we might want to repeat the question too, because it's a good one, so that the others hear.
I did hear your question. The answer to the question is yes. I can't certainly get into specifics about the lawsuit, but I did discuss things with MNsure this morning. We are carrying on with this program. We've done a lot of work over the last 10 weeks to get it up and running. And our direction from the Board of Pharmacy to pharmacies is this law is currently in effect, and they need to follow it, and I think they will. So yes, if people go in today, they should be able to get their insulin.
Thank you. Sure, do we have any more on this? And then I would be glad to go off topic. Sure, go right ahead. Yeah, well, the question around masks and wearing masks, and I've been talking about it now, it feels like most of my life, but for a long time, the easiest thing we can do, wear a mask, social distance. We saw this become unnecessarily political. I will say this, that I can tell you this is changing quickly. I watched the Vice President get off Air Force Two, walk down the steps with a mask on into Arizona. Just recall that just a little over a month ago, the Vice President did not wear a mask in the Mayo Clinic as we were meeting people, so that has changed. I still believe, like on so many of these things, that social compact of people agreeing to do it is important, but I also think, and I worry about this from the business perspective, they end up being mask police because it's not clearly defined across the state. So we are still talking about this. I hear folks, I understand, I get all the things, especially when it's 90 degrees out. Not the most comfortable thing, but it is the single most effective thing we can do to protect others, slow the spread of COVID-19. And in a rising, if you're not terrified with what Dr. Fauci said, that we could quickly approach 100,000 cases in this country, and the fear that the hodgepodge and the different rules across the country are creating just an untenable situation, we're looking at here what we can do, because as I've said all along, my goal was to get us to a sustainable place where we could manage with COVID for as long as we needed to with the least amount of disruption to people's lives. So yes, we are still in that process. We continue to reevaluate daily. And again, I think the question got asked by someone last week, does our thinking change as we start to see these numbers in other states? Yes, absolutely, but we're still looking at our own. I would say again, we're at about, our positivity infection rate is 3.7%. The difference between that and that's a 7-day average. That's up from 3.6, so a little bit there. But Arizona's now at 15%, and so the mask mandate, and I think as you see it, even in Republican-led states, they are starting to implement these. So
Republicans are seriously.
yeah. Well, first of all, we do always need to take a look at responses, especially something of the magnitude of what happened. We need to understand why the police response led to George Floyd's death, and then what the responses were afterwards. I certainly welcome that. The thing that I'm a little bit, I guess, frustrated about, I was on the phone this morning along with the Lieutenant Governor with the families of 8 folks who died in police custody: Jamar Clark, Philando Castillo, Ardell Sherrill, others, and they're just really, really frustrated. Why is the first hearing that the Senate held not on what happened there? Why are we not talking about that? Why did we leave without responding to the Democratic proposal out of the House on what we can do? So my response to this is that I certainly welcome always. I'm big on after action reports and us doing 360s on everything we do, coming back and making changes. We saw it in real time where we had responses to journalists that were inappropriate, where we had several journalists detained. I did everything I could immediately to correct that. I've asked my agencies to go back and look as how do we make sure we don't make that mistake again. So if this is done in a true bipartisan spirit of trying to find that, I think that is absolutely welcome. I do think, though, it's sending a real mixed message where the House is focusing on police reforms that, again, had George Floyd not been pinned on the neck and murdered out there on that street, I would have to say there's probably a pretty good chance everything that happened after that would not have gone that way. So as long as we have to tell the whole story, we need to get that, but I welcome that after action. Yes, we will in this. So, family up here.
everyone.